welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Brooke Trainer. She is an anesthesiologist, and she wrote the Kevin MD article, Acknowledging and Mitigating Unconscious Bias in Healthcare. Brooke, welcome to the show.
Thank you. Thank you for having me.
We'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Yeah, I'd love to. Thank you for the opportunity. I graduated medical school from the University of Miami, go Canes. Completed my anesthesia residency training at Yale New Haven Medical Center in Connecticut, after which I went on to complete an active duty tour with the Air Force in Germany as a critical care air transport physician. I finished my service with the Air Force, which was by far the best job of my life so far. Coming to Langley Air Force Base in Virginia as the medical director, I served the medical director there. When I finished up, I thought it was a nice transition to come into the VA, transition to my roots, keep with the service members. And I embarked on a career in both academic and university medicine and keep my position at the VA. I joined faculty at the Central Virginia VA healthcare system. I started up an acute pain service and then got rekindled my interest in critical care medicine, went back, took a leave of absence to do a fellowship in critical care at the University of Virginia. And now I'm working as an intensivist, acute pain physician, and an anesthesiologist at both the VA and now VCU. One of the things that I've been very involved in is organized medicine for my whole career. Several leadership positions in organized medicine, including president of the Association for VA Anesthesiologists. And I also serve as the alternate director for the Virginia Society of Anesthesiologists to the ASA Board of Directors, and then editor-in-chief of my societies, the Virginia Society. I love teaching. I love simulation. I actually have a national faculty position with VHA SimLearn, which is the Simulation Learning Education and Research Network based out of Orlando, Florida. And I teach a course for VA facilities across the nation, which was very timely for COVID, called Ventilator Education for Non-Intensivist Training, the VENT course. And these are just a few of the things that I wanted to share with you all that's, I think, a little relevant to the article.
Sure. So you mentioned your involvement with organized medicine. Why is it important for physicians to be involved with organized medicine?
This is something that is a form of us, one, staying relevant in our profession, up to date, educated, and also advocating for our patients, especially for safe care of our patients. This is a way that, even if you're not political, it's not all, organized medicine is not all political, but it has to be some. This is a lot of healthcare, unfortunately, is policy based, and a lot of it is relevant in, our legislative and legislative affairs and political affairs. So even if you're not someone who is quote, political, I think it's still important to stay involved so you can, stay relevant on standards, protocols, guidelines of your society, and stay out of trouble, keep your patients safe. These are the main reasons.
Can you give an example of how your involvement in organized medicine or the organizations that you've been involved in, how has that moved the needle in terms of advocating for physicians?
So, I do serve as president of the Association for VA Anesthesiologists. One of the things that, we are working on with, in the VA is, recently there was a big push for federal supremacy, which may be relevant and may be necessary for patients to be able to transfer care across state lines, to move resources, to enable, greater access to care. These are some of the things that we try to strive for to make sure that all patients have great access to care. But what becomes concerning is when these things happen at a rate that outpaces the need to safely monitor and care for our patients in a also not just efficient way, but a highly effective way that's the best interest of their outcomes. And this is really important whenever you're making decisions at the highest level on efficiency and access. You have to always maintain that level of safety for patients. And so we've been really vocal on our opposition to some things that we think went too far or went too fast and maybe compromised safe care to patients. And so this is our opportunity to stay as a collective voice and to be heard as a collective voice, not as just an individual, but as someone who's advocating for the safe care of our patients, especially our veteran patients who are one of our most vulnerable populations that, obviously deserve the highest quality of care. So.
All right, let's transition into your Kevin MD article. It's titled Acknowledging and Mitigating Unconscious Bias in Healthcare. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, so this is something that's near and dear to my heart. It came about as, 10 years of practice, and I didn't even recognize some of my own unconscious bias and wish that I had heard something, or had some training in this as a student, as a medical student, even in residency. And this is especially important, acknowledging and mitigating unconscious bias in healthcare, because we need to better care for our patients. And there's compelling evidence that increasing diversity in our healthcare workforce improves healthcare delivery, especially to underrepresented populations. And we know that the diversity of the US population is increasing, and this isn't reflected in the patients that we treat. The problem is, unfortunately, that this diversity is not always represented by the demographic characteristics of the healthcare professionals themselves. And this mismatch can lead to unintended healthcare inequities due to cognitive, whether you're aware of it, or unconscious, whether you're unaware of it, biases. And we need to learn how to recognize, acknowledge, and mitigate these unconscious biases that can negatively impact our understanding, our actions, our decision making when we're taking care of these patients. And I will say that over the past few years, more organizations, fortunately, are recognizing the importance of fostering this culture that includes diverse perspectives. And more organizations are having pointed and deliberate conversations on DEI topics. I know, that the ASA, the American Society for Anesthesiologists, as well as the Association for VA Anesthesiologists, is having pointed conversations about diverse, equity and inclusion topics. But we need to be discussing these at the highest level to find gaps where we can learn and dedicate resources for improvement. And it's necessary that, even if it means confronting awkward topics and having uncomfortable conversations, that we need to be working towards efforts to improve diversity in the workforce and active in our outreach. And the problem doesn't improve if we choose to ignore it or worse, deny it. So.
What are some examples of unconscious biases that physicians may have? And can you give further examples of how those biases can affect patient care?
Absolutely. So, this is something that I came across again, like I said, I'm a decade into my practice, and I learned a crucial characteristic about myself. And so, I think that having been unaware of how implicit bias can play into your decision making, I actually don't know what impact I had on patients. And now I am much more aware of it. So I mentioned earlier that one of my roles in organized medicine was serving as our state professional society journal editor. And so a few months ago, I proposed that we publish an issue themed on DEI. And so I wanted to recruit diverse speakers to write for the issue. And I really had sincere intentions and genuinely wanted to do the right thing. But one of the racially diverse authors that I approached, whom I considered to be a consideration for writing an article about maybe her perspectives, or really choosing whatever topic she wanted, she opened my eyes and changed my perspective on how I was approaching the subject. I want to thank her for this genuinely. But her first question to me was, "Why are you only now asking me to contribute an article?" I was like, oh, she's right. Up until now, I had never thought to reach out to her to write an article. And her follow-up comment to me was, "Why does every white person think they need to ask an underrepresented minority how to fix or resolve this issue?" And I could see that obviously she was frustrated. She made a valid point, though, and this was likely not the only encounter that she had experienced this subject. But rather than get turned off by her contempt, it actually challenged me. So I wanted to investigate further why she felt compelled, to explain. And I was grateful for her explanation. She gave me the example of how unconscious bias likely contributed to the poor representation of minority trainings in her program. And she challenged me, whom she considered a leader in our specialty, to write about the issue and come up with solutions on my own. And I hadn't thought of this before. I didn't think it was appropriate, honestly. I didn't want to claim to be an expert in something that I don't know much about. And I certainly didn't know what to say, but she helped me to understand the issue and see her perspective. And what she told me was that when she came to interview at her current training program, she was one of the top graduates of her program, and she'd been looking forward to this day, albeit she was very nervous, wanted to make a good impression. But she was dismayed on the day of her interview when she was met by an all-white male interview panel. And she tries to recall and thinks there may have been one Indian female, but that she didn't meet her or have a chance to talk to her. And she further explained that though everyone's very nice and professional, she never felt like she connected to anyone. And to make matters worse, the evening after her interview, all the interviewees were taken out to dinner to a restaurant that was decorated in Confederate Civil War memorabilia. And she wondered if it was almost a subtle message that they were trying to send her away or to stay away. And in the end, she was surprised to learn that she did end up matching into the program, but she explained that it was actually one of her, though it was one of her top choices prior to interviewing, it was one of her last and bottom choices after the interview. And ultimately, she confessed that she was happy to match there and realized afterwards that all of those, quote, white men who interviewed her were in fact genuinely good people and cared about her. And they promoted her. In fact, they nominated her to chief of her residency class. But why was she one of the only minorities in the class? And both of us started wondering and postulated, had they better diversified that interview panel, as well as chose an alternate restaurant to take them for, with less offensive decor, that perhaps the composition of her training class would have been more diverse. And we both agreed that it was highly likely that these unconscious biases, turned away a lot of really high quality, diverse candidates from this program. And so I did feel compelled to write about this and say that just as much as we want to recruit diverse people into our programs, we need to be putting diverse leaders on these panels for these selection committees and considering these unconscious things. So that was my aha moment during my conversation with her. She really opened my eyes to this.
What would be some of the immediate next steps that you would do to help solve this issue of unconscious biases?
I think, go back to my fundamentals, and anyone can do this, the fundamentals of what can you do, now kind of thing. And, I'm super passionate about teaching and mentoring, and everyone's different. I haven't discovered any new drugs or fancy devices, but I think that, I'd still like to leave behind a legacy, with my children, with my family, and then also with the folks who I am teaching and mentoring along the way. And so I think by passing on this wisdom, by writing about it, by talking about it, by teaching, and then by helping, attain leadership positions where you can actually directly influence these decisions. This is how we can, with small steps and, individually even take, little bits of opportunities, to think differently, constructively, creatively, and then influence and advocate for things that are right, our beliefs, stand up for our convictions, be authentic, try to be, like Mahatma Gandhi says, the change that you want to see in the world, step by step, little by little.
We're talking to Brooke Trainer. She's an anesthesiologist, and she wrote the Kevin MD article, Acknowledging and Mitigating Unconscious Bias in Healthcare. Brooke, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Well, I think I've stressed a lot about making sure that when we are, interacting with patients or interacting with employees or colleagues or, even in leadership positions in these organizations, that we are deliberate in our actions, that we reflect on them. And so I hope that the audience takes away from this interview the importance of diversifying interview and selection and promotion panels. Hiring great candidates is a two-way street. They have to want you as much as you want them. And then the second lesson, I hope clinicians, particularly leaders in healthcare, take away from this discussion is the need for healthcare organizations to seek and recruit diverse healthcare workforce. Like I said before, we know that the increasing diversity in healthcare workforce strengthens our ability to care for culturally sensitive and diverse patient populations. Patients want to connect to their providers.
Hmm.
And in order to connect, they have to find that, that relationship and have some similarities with them that builds trust. And I talk about that a lot in the article, being able to build trust in your provider, trust in your patient, provider relationship. And, I think efforts should be made to not only select the best candidates, but also the best people to interview for those candidates. And so one way we can achieve this is by being intentional in our diversification of these panels and, especially during the hiring process and recruitment process. And they should be comprised of varying backgrounds of people that represent the demographics of not just the organization, but of the patients they treat. And I think this exemplifies an organizational culture of diversity, one which prioritizes inclusivity and aims to ensure fair and equitable selection of candidates from diverse backgrounds.
Brooke, thank you so much for sharing your time and insight. Thanks again for being on the show.
I appreciate the time. Thank you so much.